Welcome, everyone. We're going to go ahead and get started. I think a few more people might be joining us, but we're going to go ahead and get started. If you would like to respond to the poll questions that should be popped up on your screen, you can go ahead and do that. We'll close the poll in just a minute and it will show everybody what the responses are. I'd like to welcome everyone to this Living Well webinar. We're going to be talking about taking care of ourselves during stressful times. If for those of you that don't know me, my name is Shannon Lozinski, and I'm the Director of Patient Services at the Chordoma Foundation, and I'll be the moderator for today's webinar. We're so glad to have everybody join us. We had quite a few people registered today. We've got about 30 people joined so far, which is really great. We're so glad to have everybody with us. Before we go any further, I do want to remind everyone that the webinar is being recorded and it will be made available in the next few days on the Chordoma Foundation website and on our YouTube channel. Before I introduce the speakers, I wanted to mention a few tools that we can use to help make the webinar as interactive as possible. At the bottom of your screen, you'll see a few buttons. If you click on the chat button, a chat window will appear, and you can use this to talk with each other and say hello, share comments, discuss things. If you have any technical issues, please send a chat to all panelists and someone will help you out. We will have a few minutes after the first presentation for Q&A, and then we'll have about 15 minutes at the end that you'll be able to ask questions, make comments, share stories. And the speakers may ask some questions of the participants during presentations as well. And so you can use the Q&A tool for that. You can go ahead and also share comments and questions during their presentations, and then I will direct those to them during the Q&A. So if you click on that Q&A box, a window will pop up and you can type your question in there, and I'll be keeping an eye on those. And you can submit those questions anonymously. So if you would like to do that, just check the box for anonymous, and then your name won't appear with any of your comments. So again, use the Q&A tool to communicate with the speakers and the chat tool to communicate with each other. And I should also note that the chats and Q&A will not be part of the recording. That's just for us to use here today. So I'd like to welcome and introduce our wonderful speakers. We're so glad to have you with us today. As many of you likely read in a recent blog post of ours, Susie Caldwell-Reinhardt is not only a Chordoma survivor, she is the author of a book called Fierce Joy. She's also a public speaker, a leadership coach, an ultra runner, and last but not least, a mom of two. If you haven't read her book or her blog, she's inspiring, hopeful, and just has a wonderful way of looking at the world and the challenges that come with it. Susie was set to be the keynote speaker at our community conference that was scheduled for this summer. And she was also going to speak to the doctors and researchers at the Chordoma Research Workshop. And then COVID came along and changed the plans, and conferences got postponed. So we're very excited that she's with us here today. And along with Susie is Amy Bragman, who's a licensed clinical social worker at MD Anderson Cancer Center. Amy was part of the community conference we hosted with MD Anderson in 2017, and she led a breakout session there. So for those of you that attended that conference, you might remember her. You may also recognize her from a couple videos in our Expert Answers series, which are available on our website and YouTube channel. As part of the Brain and Spine Center at MD Anderson, Amy has worked with Chordoma patients who are being treated there. She provides one-on-one support and counseling, as well as facilitates support groups and connects people with psychosocial care and resources. And we're really happy to have her with us again today for the webinar. Susie will be starting us off. So with that, Susie, I will turn it over to you.
Hi, everybody. I'm so glad you're here. I'll just dive right in and tell you a little bit about me. So I'm Susie Reinhardt. I'm 49 years old. I am a wife. I'm a parent. I was diagnosed in 2016. My kids were 10 and 12 at the time. Since then, I've had 3 craniotomies, neck fusion, recurrences, about 13 weeks of radiation, and some experimental chemotherapy during COVID. So I want to speak to you today from the perspective of a patient. I'm not a clinician, and I understand that no two journeys, even with Chordoma, are alike. So I want to just talk with you as like patient to patient, because some of you are probably trying to do this alone or go it alone, even if you're in a very supportive family unit. And I think that siloed case of going alone adds to our stress. I realized as I was thinking about this today that I have never actually met another Chordoma patient, because I think we're like these rare flowers, right? We're like the lady slipper orchid, or if we're a mammal, we're like the hairy-nosed wombat of the types of life-changing diseases out there. And so to me, to know that you are all out there is incredibly important to me, and already gives me a sense of relief from some of the stress that I feel, to know that other people are going through this. So right now, I'd actually love to see, because I can't see you, and I'd love to like hear from you. So what is the most stressful thing for you right now? Is it the diagnosis? Is it your treatment? Is it COVID? Is it the holidays? Is it the combination of all three? If you could just pop things into the Q&A of just 1 word or 3 words, that what is causing you stress right now, that would really help me to hear from you. And as those come in, there we are. Yeah. Okay, so I'm gonna. Yeah. Definitely. Okay, so because I don't think you can see so much of these, I'm just going to read some of them out loud because I hear you, right? Uncertainty, COVID isolation, COVID and wondering if it will recur, waiting for new radiation to begin, traveling, for experimental chemotherapy while having a 5-year-old and dealing with COVID. Test results, stress around possible recurrence, not being able to be with the ones I love, COVID. Trying to protect myself and others in the slow progress after 3 years of treatment. COVID and the political divide, limited time wasted by COVID. Yeah, I hear you guys. This is just, are you guys reading my journal? Because this is all the things that are written every night in my journal. So the first thing I want us to do, and I'm sure you know about some favorite breath you have, but I just want to teach you my favorite stress breath. So it just goes, I'll show you it and then we can do it together, which is, it's a 5-5-5 breath. So some people call it a triangle breath. But the key part is the holding part in the middle. So you inhale for 5 through your nose, and then you hold for 5. And I count down there, so don't let the thoughts creep in. And then I exhale again through your nose. Actually, sorry, exhale through the mouth for this, because what I want to hear in the exhale is like a ha. So it's inhale through 5, hold for 5. Don't worry, we'll do it all together in a second. Exhale with a ha sound. And the reason we want to hear that ha sound, or fogging of the mirror, is because that activates that vagus nerve, which then stimulates the part of our nervous system that goes from fight or flight to rest and digest. So by stimulating that vagus nerve with that ha sound, we're actually telling our bodies, I am stressed. All of these things I'm feeling are real, and yet I can rest and digest. I can relax during COVID. I can be here. So you want to try it with me all together, and then I want you to tell me just quickly in the chat if you have a favorite breath technique that works for you. But okay, here's what we'll do. So inhale for 5 through the nose. Hold for 5, and I count down. 4, 3, 2, 1. Exhale. Okay. We've got a long, dark winter ahead. COVID is still with us and we don't know when it's going to go away. Our diseases or your loved ones' diseases are still with us and we don't know if they're going to come back. We don't know if they're going to, we know they're never going to go away, but we don't know what they're going to do. And I'm just curious if you can tell each other too, if you have a, like if that breath works for you, or if you have another one, you could just put the name of it or something and we could look it up later. The type of breathing that might really help us in the middle of the night when we wake up spinning with thoughts, or midday, or mid-morning, anytime that we feel that overwhelming feeling. Okay. The second thing I want to teach you while you do that is what I call my 3-2-1 plan. And the purpose of my 3-2-1 plan is to remind me to connect, move, and breathe. So this is really useful for any of you if you're waiting for scan results, or you're in that kind of waiting mode and you're afraid of traveling, or you're afraid of a recurrence. My 3-2-1 plan, like I just had all my scans yesterday, or 2 days ago now, and I won't know the results until next week and talk to my doctors. And even then it's gonna be Thanksgiving, so it'll probably be December. So my 3-2-1 plan comes in handy during these waiting. And what I do is 3 stands for people, 2 stands for place, and 1 stands for thing. So if you've got paper and pen, or you've got your phone or your computer right in front of you, I want you to think about 3 people who lift you up. And they're not the people that you are with, that you're potted with right now. So I want 3 people who adore you, that you don't connect with enough. You want to write their names down. And those are the people that you're going to connect with when you're feeling stressed. One of those 3, you're just writing 3 names so you've got them. And if you can't think of 3 outside your pod, just go ahead and put my name on there too, okay? Because I would love to be in contact for you. It's really easy during COVID to just get caught with our group and our families, and to forget really that there's all these other people that care for us, that are funny, that understand where we come from and what's going on. And having the excuse almost to connect with them is going to be really, really important through this winter. 2 stands for places. So where do you go to support your mind and your mood? So do you feel better when you walk outside? Like where specifically when you're walking outside do you start to feel better? Do you start to feel lifted? That you could put in the chat for each other. Where do you go to support your mind and your mood? And this is all related to move, right? So it could be your bathtub. It doesn't have to be outside. It could be a chair by the window in your house. It could be your bed. Okay? But I want you to at least name 2 places where you can go that lift your mind and your mood. That's right. If you can go to that place, like a beach house, even virtually, right? In your mind, I don't have a beach house, but I pretend. And I have this place that I sit in my house by a window and I imagine I'm looking out at sea in this horizon. So that counts too. Yeah, the woods, anywhere, trees for me are it. I'm an unabashed tree hugger. Okay. Then the 1 stands for a thing. What's a thing that you do that tends to lower the stress? So is it that stress breath or a favorite breath you have? Is it music? Do you have a playlist that lifts you? Is it baking, writing in your journal, doing yoga? What is a thing that for you kicks you out of spinning thoughts and into a place of like resiliency and strength? I want you to write down your 3-2-1 plan. 3 people, 2 places, 1 thing. Put it on a card. This is mine. It just looks like this. Sorry if it's backwards for you. I'm not going to tell you my people. You put this down. Mine lives right underneath where the hospital numbers are, poison control, the nearest fire station. It's right there on my like wall in my kitchen. You can stick yours on your forehead if you're going to forget. The idea is that it's simple, that you can go to it in an emergency, and that's there for you always. Okay? Any thoughts on that? Thank you. I love these things coming in the chat and the Q&A. They're really great. So the last thing I want to show you, and I hope we're okay, Shannon, I want you just to cut me off on time, is something I call learning how to separate clean pain from dirty pain. And this comes from Martha Beck, who is Oprah Winfrey's coach. And she talks about how clean pain is things like the broken bone. And in our case, it's like the diagnosis, it's loss, it's surgery, it's radiation, it's COVID. These things are clean pain, they're real. The dirty pain is what we add to situations with our brooding, with our tendency to believe all the thoughts, especially the extreme ones that come into our mind. In mine, I have a really powerful one that sort of loves dark thoughts, like, this is it, I'm going down tomorrow, this next reoccurrence is going to take me out. Or the other extreme, which is like, the scans are going to be totally clear, it's going to be this miracle, I'm going to be totally gone. And so I sort of live between these two extremes, and it's as if I'm not going to be happy with any grayness in between. So in Martha Beck's research, she says that the vast majority of unhappiness comes from the dirty pain, that constant stream of thoughts about the events and not the events themselves. So the solution is to separate clean pain from dirty pain, and to notice our judgmental thoughts that come in, or our extreme type of thinking that comes in. And you'll notice them, you'll recognize them by, they sound like, you should do this, or this should be happening, or I ought to do this, or I have to do this. Those judgmental thoughts that are kind of putting in a lot more on you than necessary. I should be a better parent. I should be more present, okay? There are also what if thoughts, like, what if I go to the hospital for treatment and I get COVID and then I have nothing to show for my situation, right? So this whole idea of separating clean pain and dirty pain is not like a one and done type of solution. It's actually something I do every day, where I'm just noticing and observing my thoughts and trying to separate, oh, this is dirty pain. I can let go of some of this dirty pain and make space for possibility. My story, some of you may really know this already, but I had always wanted to be a writer before I was diagnosed. When I got diagnosed with this tumor, I had this very strong feeling of, I never got to write. I never got to write. And what was getting in the way for me was like, I was trying to get it right all the time, like RIGHT. I was always trying to get the first pages of my book perfect. And so the same thing that happened with these clean pain and dirty pain thoughts, when I got the diagnosis, I was like, excuse my French, F it, right? Like, I don't know what I have left. I don't know if I'm going to get it right. I don't know if anybody's ever going to read this, but I'm going to choose right now brave over perfect. And in terms of my diagnosis, I'm going to choose joy over fear. So choosing brave over perfect and choosing joy over fear for me is a daily calibration of like, what's the choice right now that is going to give me a little less stress over, like, what's the choice that's going to cause me to go down to a rabbit hole of fear, okay? So the last thing I just want to tell you is that, you know, the doctors are always saying to me, like, go, scans are done, not too much change, you know, or we're just going to monitor and go live your life. And I used to be like, that's really difficult to do, because this idea of my life has changed so much, and we can never go back to this idea of like what our lives were before. And so I don't want you to forget like what we are carrying and what we have, and that there is very real pain and real loss with our diagnoses. But also that, like, I don't want you to forget it. I want the diagnosis to let you, to guide you, I guess, so that you can make decisions towards like love and give, rather than like fear or take, right? So that joy over fear piece. And then the question with COVID, especially for me, right before we go to some questions and to Amy, is with COVID, people are always saying, you know, when will it end? When will we be able to go back to normal? And I think that the question that has helped me so much is framing it a little bit differently and saying, we don't know when it'll end. We don't know when we will end. We don't know if there will be a reoccurrence or not. So if we don't know when it'll end, how can I make a real life in this now? And my choice with you guys is to remember my 3-2-1 plan, right? To remember my stress breath, and then to remember to try to separate clean pain from dirty pain. Don't judge it, just let it drop on its own. And all of this and like 300 more things is like in this book that I finally did right because Brave and Perfect. So with that, I want to thank you guys, and I want to let me hear if there's any specific questions for me, or we'll just go right to Amy. Okay. Thank you.
Thank you, Susie. That was wonderful. We had some comments come in. Some people had never heard of clean and dirty pain before, so that was a new concept, probably for quite a few, and was a really great way to picture it. So I think that's going to be really helpful for people for some time to come. And I think I remember there is a blog post on your website about 3-2-1, right? Yeah. So so if anybody wanted to read some more about that and think about it some more, it's on Susie's website. And I don't see any other comments or questions that have come in right at this moment. Someone made a comment, Susan made a comment that about the Buddhist philosophy of pain is inevitable, suffering is optional, and noted that suffering and dirty pain are connected there. So yeah. Okay, great. So we will move on to Amy's presentation, and we'll be taking more questions at the end, or comments, discussion, all of that. So Amy, I'll turn it over to you.
Thank you.
Thank you, Shannon, and thank you so much, Susie. That was amazing. I appreciate your perspective so much. I know we've spoken some before this, and I just think you have the best perspective and kind of viewpoint moving forward and living your life. So I'm going to share my screen, just talk some more about some tips for coping and caring for yourself during this time, which is definitely, give me 1 second. Okay, perfect. So as Shannon mentioned, I am a social work counselor at MD Anderson in the Brain and Spine Center. So I work specifically with patients who have brain and spine tumors. So a lot of chordoma patients. I've worked there for almost 6 years now. So I have a bit of experience working with patients like you and your families. So I hope to provide a little bit of hope and support and recommendations to help cope with everything going on right now. Okay, so we're just going to talk a little bit about adjustment and coping, and then talk about resilience and some self-care strategies, and then some specific resources. So a new diagnosis of cancer, chordoma, can throw the entire family system off balance. And it oftentimes requires role changes for both the family and for both the patient and their family members. This is true for a lot of families right now with COVID as well. Everyone's sort of experiencing this shared trauma because we're all experiencing this together, and that fear and those changes to our family systems, that's happening to a lot of us. So while cancer is a very different trauma and a very different experience, a lot of people are experiencing some of these same feelings of anxiety and fear and uncertainty. So it actually, I feel like, can bring a lot of us together in a way that we maybe haven't been in the past. So at a new diagnosis, as well as Every time you go for a scan or every time you go for a treatment planning appointment, there are a lot of new feelings that occur. That increased anxiety, that fear, the uncertainty. I know I saw a bunch of you saying uncertainty is the hardest part, and the not knowing. And a lot of that comes from a lack of control. Um, and when we can't control something, we tend to become anxious because we want to be able to control the outcome. And a lot of times in life, we can't do that. But what we can control is how we respond. So again, all of these feelings are completely normal. It's just how you handle them. So feelings of anger, irritability, guilt, feeling guilty for not being able to do the same things that you've been able to do in the past. Maybe you can't contribute to your family as much as you could have in the past. Feelings of sadness and depression, which again is understandable when you're dealing with sometimes a terminal diagnosis, when you're dealing with a diagnosis that can affect your functioning and your quality of life and potentially your lifespan. That definitely causes feelings of sadness and depression in a lot of people. The confusion kind of ties in with anxiety, the uncertainty, the not understanding why something like this could happen to you. And then grief. I think grief is something we don't talk about enough in our daily lives because I think we associate it with death, but really grief is a feeling of loss. And a lot of us experience feelings of loss in our daily lives. Especially with COVID right now, a lot of people are losing their jobs or losing their ability to see friends, which you may not think of grief when you think of those things, but every loss can create feelings of grief. So for chordoma patients, I know a lot of times that's physical functioning and independence, and the loss of those things really truly can impact your quality of life if you don't understand what you're feeling and how to cope with those feelings. So another way that cancer, chordoma, can affect us is by increasing marital difficulties and family conflict. We know that a lot of role changes take place when there is a cancer diagnosis. A lot of times people may have to stop working, go on disability. Your ability to care for children might change, your daily activities might change. And so it forces the family to make accommodations and to reorganize how the roles are defined. And a lot of families, again, are experiencing this year with COVID and all the changes it's caused in our lives. Intimacy issues, both physical pain and deficits can create issues with sex and intimacy. And it also is hard sometimes to even see ourselves as intimate individuals when we are experiencing pain and suffering and not feeling like ourselves. Children's coping, for all of you who have kids or grandkids, trying to manage your children's coping while also managing your own is a challenge in itself. And then you have the involvement of extended family, which can sometimes be good and sometimes be bad. It could be that you have a lot more people involved than you're used to, and that could be very overwhelming. Or it could be that maybe people aren't as involved as you would have expected them to be, which can also be very difficult to cope with. So I just wanted to kind of go over those things to normalize a lot of the feelings that patients and their families express to me on a daily basis. But what I really want to focus on is resilience and self-care strategies, because I think that is how we can focus on kind of moving forward and coping with what's going on. So resilience in itself is the act of rebounding or springing back and recovering with strength, spirit, and good humor. So resilience isn't about just surviving, but about thriving and finding the benefits from a negative experience. So a lot of times the diagnosis kind of throws you for a loop. It's you experiencing those feelings of shock, maybe denial, maybe isolation. Resilience is how you come back from that, and how you kind of come back into the world with those coping skills. So some specific skill areas I want to talk about for developing resilience are social engagement, self-awareness and self-care, attention and focus, and then finding meaning. So I'm going to go through these and talk about some really specific things that you can do in your daily lives to try to help develop that resilience. So social engagement. I know Susie talked a lot about isolation, especially during COVID. I know that that is causing a lot of people to feel even more isolated because you can't physically interact with people as much as we used to. But even if it's a phone call, a video chat, any way to engage with other people is really going to help improve your ability to be resilient. The ability to cultivate those social connections and avoid that social isolation will improve your ability to kind of bounce back because you have that support from others and you're not on your own trying to do this. So some specific activities, volunteering in your community. Again, that doesn't have to be in person, even if it's volunteering to be a mentor for someone, volunteering to help with chores for a neighbor, whether it's, running an errand or something like that. Showing appreciation of others. Whenever you show appreciation to the people in your life, they will show appreciation back to you. It's kind of we get what we give. And a lot of times, especially during stressful times like this year in the pandemic, it's hard to sometimes recognize the good that other people are doing for us. And just acknowledging and showing that appreciation will make you feel better about yourself and also improve those relationships. Being an active listener, actively listening to other people can really help bring you out of your own head. A lot of times we just kind of get stuck in our own brains. And when we listen to other people, it just kind of helps take us out of that singular mind space. Random acts of kindness, again, giving back makes all of us feel good, even if it's something little like opening a door. Those things really do add up and make you feel more resilient. And I have on here unplug and meet people, but I guess now with COVID, it's more kind of plug in and meet people because so much of this is being done over the internet now and over the phone, which is great. And I think now is the best time to take advantage of technology in the ways that we connect with other people and really using that to our benefit. Self-awareness and self-care. So self-awareness is the ability to understand your own emotions, strengths, weaknesses, basically to understand the good and the bad within yourself. And to understand kind of what causes you to feel certain things and do certain things. And then self-care are those behaviors and things that we do that maintain our overall well-being and personal health. So these incorporate physical self-care, emotional or psychological self-care, and spiritual self-care. And these all mean different things to different people. And we're going to go through some specifics, but None of these are things that you have to do. They're just options for self-care strategies. So some activities to increase our self-awareness and self-care are, as far as the physical side, exercising regularly. I know that has been more challenging with COVID, but going on a walk around your neighborhood, even if it's as small as a short walk once a day, moving and getting outside regularly really helps increase our endorphins and our mental health. Eating well, I know everyone's schedules are a little different. All of our routines are a little off, but eating regular meals and eating as healthy as we can um, improves our physical functioning, which makes us feel better overall. And then getting plenty of sleep. Lack of sleep increases anxiety, depression, stress, all of those things. So getting a good night's worth of sleep is really important. And it sounds simple, but I know everyone can relate to waking up, having had a couple hours of sleep and just not feeling your best. So we know that impacts our emotions. So definitely being sure to eat, sleep, and exercise regularly is important for our mental health. Learning to identify our emotions. Sometimes counseling can be helpful with this if you've never really been able to identify what's causing you to feel certain things. You know, a lot of people have anxiety or depression their entire lives and don't realize that that's what they're feeling because they didn't know that wasn't how everyone feels. And so sometimes talking to someone just to really tease out what it is you're feeling can help put you on a path to coping and recovering from those emotions. Journaling. Journaling is a really great self-care activity, and it really does help promote self-awareness. Even if it's just a couple positive things that happen during your day, that is something just to help kind of focus your perspective. One counseling technique in regards to journaling is called the 3 positive things. And you start each day with writing down the 3 things that you are grateful for or looking forward to that day. And then at the end of the day, you write down 3 things that you are appreciative of that happened during the day. And doing that helps kind of shift your perspective to look for the good, which is sometimes hard to do in this world. Meditation, Susie talked about this some, but meditation and mindfulness, even the breathing exercises, those are great. Those are great strategies for self-care. There's tons of research on how beneficial they are for calming our entire bodies and our stress systems and deactivating those stress responses. So meditation, mindfulness, relaxation strategies, those are all very beneficial. Support groups or counseling. Right now, a lot of support groups are being held online and virtually. Counseling also can be done either in person or via telehealth. So even though we are in this kind of different time with COVID, there still are a lot of support options for you to get the help that you need. Spending time in nature. I know we talked about walking outside and how good the fresh air is for you. And I know when Susie was asking about your favorite places to kind of relax, and a lot of people said the woods or beach house. Those are wonderful. Any time that you get to kind of connect with nature and disconnect from the rest of the craziness of the world, again, that helps with the self-awareness and the self-care by quieting down a lot of that commotion. Attention and focus. So attention and focus, this is related to mindfulness, which I mentioned. So this isn't, it allows you to tune out irrelevant information and perceptions in order to focus on the moment and on the information that's important. So mindfulness, which I know this is talked about a lot, but there are a whole bunch of different mindfulness activities, but most of them focus on just either focusing on your breath or focusing on an object and working to clear everything else out of your mind. That sounds a lot easier than it is. It can be really difficult, especially for people with anxiety, to really calm their minds down and try to focus on one thing. But the more you do that and the more you practice it, the easier it becomes. Those deep breathing exercises like the one Susie led us through are great for, again, allowing us to focus our attention on what is in the present. Guided imagery. So Susie kind of mentioned this as well, but even if she said, you know, she doesn't have a beach house, but imagining that she's in a beach house makes her feel more calm. And that's sort of what the guided imagery is. If you can't go to the woods, closing your eyes and picturing that you're standing there in the woods, imagining the sounds, the smells, everything that you would see, and kind of immersing yourself into that environment, even though you're not really there. And then meditation, which is another form of mindfulness. But basically, you're working to clear your mind and to kind of stop all those thoughts from racing. And you're trying to focus on just letting your mind be calm. Yoga is a great practice for helping work on meditation practices. Okay, and then the last key part of resilience is, is the act of making sense of an experience and determining the significance of the event or of the experience. So for Chordoma, I know this can be really difficult because there are so many negative ways that it impacts your life. But like Susie, she used her diagnosis kind of to be that kick in the butt to write and to create this book that has helped other people now. And she now acts as, you know, a mentor and a life coach, and those types of things, finding a way to either give back or find that sense of purpose is so important, because it helps us kind of make sense. Because nothing makes sense about cancer, why some people get diagnosed, why some people don't. You'll drive yourself crazy trying to make sense of it. And I think if we just try to embrace the changes and find a sense of purpose in that experience, it helps us to cope with it overall and help develop that resilience. Again, making short and long-term goals and working towards them really helps. So even if it, you know, the short-term goals today may be go for a walk outside and call a friend. And then maybe longer term goals, you know, are write a book or, you know, create a blog. But anything like that to keep yourself motivated. And then I just wanted to share a few resources for support and mental health. So support groups are wonderful. There are a lot of online communities that also sort of act as support groups. Chordoma Connections is on the Chordoma Foundation website. One-on-one peer support programs are really great. Chordoma Foundation Peer Connect, My Cancer Connection, Immerman Angels, those all facilitate connection between two patients or caregivers who have a similar experience or a similar diagnosis. So that mentor support can be really helpful. in helping to decrease those feelings of isolation. There are also places that you can call for people to talk with you, professional support. Cancer Care has telephone counselors available 24/7. Chordoma Foundation has patient navigators to help you through things with navigating the system. American Cancer Society is also a great resource. And then mental health. If you're looking for a local counselor, Psychology Today is a great resource to find one that kind of fits your needs. And if you're needing to meet with a psychiatrist or a psychologist, you can also contact your insurance or primary physician for a referral to a counselor or a psychiatrist. And that is the end of my presentation. So I'm going to stop sharing this and see if there are any questions. Okay.
Thank you so much, Amy.
Of course.
That was wonderful. Before, let's see, I'm going to share my screen real quick. I want to make a note before we start taking questions that during this portion, we would also like to make it possible for participants to unmute themselves and to be able to share a question or comment. If you would like to do that, you can click on raise hand and I will call your name, first name only, and you'll be prompted to unmute. And once you unmute yourself, we'll be able to hear you speak. And the only thing we ask is to be mindful of keeping comments brief and questions brief so that we can get to everything. So if you'd like to use that, it's there. A few comments and questions have already come in. There was an interesting point made that coping skills that a patient has already learned and practiced themselves is coming in really handy now with family members with COVID, teaching them how to deal with something stressful. And it made me realize that, you know, probably for a lot of Chordoma community members, whether you're a patient or a caregiver, family member, there are probably a lot of coping skills learned already at this point. And then when you get to teach those to others, it can, you know, give you benefit as well. Let's see, we had a question for both of you guys, Amy and Susie, about if you could comment on the importance of a spiritual dimension in coping.
I can start if that's okay, Susie. Okay, yeah, so I know I mentioned this. So spiritual, the reason I didn't get into specifics is because I feel like spiritual care looks different for every person. And for some people that's praying, which is great. For some people it's going to church or temple and experiencing that community. For some people it's going outside and being at one with nature, and that's where they really feel that spiritual connection. So, you know, I think for every person, it's just finding where you feel that connection. Yeah, Susie, do you have anything to add on that?
Yeah, I'm not affiliated with any church or temple or group, and even though, and I tend to be someone who borrows from all different faith organizations, because anything that takes me a little bit out of my physical body or my mind that is analytical and spinning helps me. And so my prayer is like a secular prayer, but basically it's just like, okay, universe, we've got this big challenge, you and I need you in my corner. So I can do this. I get it. Thank you for this challenge, but I need you in my corner. So please be there, because I prefer to be on this earth with my children, with my husband, serving others. That's helpful.
I've also noticed or seen that there's a lot of parallels, and I think there's some science and research to back this up, that deep prayer and meditation are activating the same points in our brains. And you know, we think of them maybe as different things sometimes, but yeah, for as far as a spiritual or religious component, prayer is a form of meditation, and so those are parallel things there, and yeah, can provide the same benefits. I have a question. There was a question about, I'm sorry, did you want to add on to
I
that,
just
Susie?
wanted to say one thing that came up a little bit in the chat, and I'll just say quickly, especially for those of you who are feeling like a lot of physical discomfort or feeling like they can't be present with their families. One thing that I don't think we do enough as good people who go to webinars, is like give ourselves permission to do nothing. So here are the holidays coming up, right? And like we may want to make it extra special for our kids or for our parents or for our loved ones, or we may be really scared around COVID. Like you have a giant permission slip with Chordoma to do only what you want to do, and maybe the treatments that you feel you want to do, right? So like, please, with your children, I remember that I made it really specifically, I wanted to focus on them and doing like little advent calendar stuff or light spiral of lights with them. And so the meal stuff, we just didn't do. I got, good healthy stuff from Trader Joe's and frozen boxes. And we ate that so that I could focus on making memories and traditions and only doing the stuff I wanted to do. So please take that permission to do nothing this holiday.
Yes, very good point.
Sorry, Shannon.
No, that was great. The question, next question would be about, Amy, you mentioned there are virtual support group options. There always have been, but it's kind of more prevalent now with COVID. Do you have any tips on where to find those, like how to search them out? You mentioned Psychology Today, which is a great resource for finding individual counseling and therapy options. Is there also support groups on Psychology Today, or where would people find those likely?
Yeah, thank you. So I would start out by checking with your local hospital or treatment center, because a lot of cancer centers, like at MD Anderson, we have a variety of support groups, all of which are virtual right now. So we do have some general ones, as well as a brain tumor support group and some other specific ones. But I would start with the hospital or treatment center where you're being treated. And then Psychology Today also does have support groups on there, as well as therapists and psychiatrists. And then I would also look on cancercare.org because they do a lot of telephone and virtual groups through their organization.
Great, thank you. There was also a question about Chordoma Foundation offering Zoom support groups during COVID, if that might be a possibility. And it actually is something that we have considered and discussed, and are kind of looking at different ways we might be able to make that happen, maybe a once a month group. And even without COVID, I think that's valuable, just because it would be one of the only support groups meant for Chordoma community. A lot of people find great things and get a great benefit from support groups that are not Chordoma specific, because that's very, it's a difficult thing to find in local institutions. So yeah, we definitely want to consider that for the person who asked that question. And we have a comment about reinforcing the benefits of things like Chordoma Connections. It meets the need to understand there are others dealing with similar things, and is also affirming to share experience that helps others. And coming from someone, a member of Chordoma Connections, who I know does share a lot of helpful and encouraging things to others, we love to see that. We built that community to be exactly that. And so if you are not a member yet, I hope everyone on the webinar will consider joining, because there's a lot to gain from it. I wondered also, about, this is a question that I actually had for you guys. Um, Amy, you mentioned identifying emotions, and Susie, you also talked about the difference between clean pain and dirty pain, and how those are both emotions and they're very tied together, but they could be kind of separated. Um, and are there some specific ways or strategies that you use to help people do that when they're really not sure? It just feels bad and they don't know of any other word for it. Are there certain strategies that you have for kind of guiding people through and really figuring out what that is? Let's see.
Amy, do you want to go first?
Yeah.
Yeah, I can go first. So honestly, this is where I personally think counseling is really helpful. Just because it is so hard to sometimes figure out what part of our brain is causing what, and a lot of us don't realize a lot of the experiences that we've had that have an impact on the way we think. We just think that that's the way a brain is supposed to work. So we don't realize that these past experiences are kind of impacting the way we perceive other situations. So sometimes that counseling can just help with that self-awareness piece and teasing out what things you're feeling because of the experience and what things you're feeling because you're reacting based on a past experience or stressor.
Yeah. There's a couple things quick, Shannon. Like for me, recognizing the dirty pain is that it's always extreme. It's always fast paced. It's always negative. It's not helpful. It's not leaning towards a solution or a practical way to feel better. You know, like that is the sort of dirty pain sound. It helps actually give it a name to detach, to totally detach from that. Like I call mine fear with a capital F, or I call it sometimes bo, as in like boring, like you're the most boring thing about me. You're so boring, you're there all the time. But there's a lot of times, Shannon, where what I have to coach people through with coaching is we just have to breathe for a while. Like you have to do that stress breath for a long time until you can separate them out. And it's definitely not the same thing as this, like, think positive. No. It's feeling all the feelings, like all the loss, all the anger, all the, bitterness and guilt. And then just like breathing until you're like, okay, is there an alternative truth? Like, yes, I'm going to die. Everybody's going to die, right? Yes, like all these things are true. Is there an alternative truth right now that helps me get through these next 2 hours? So that's what we work on.
Yeah. I like that. Well, time has flown by, you guys. It's 2:00 already. Just to kind of close us out, I'm sorry we don't have more time to keep talking. I think we could probably have continue a great conversation. So I wanted to mention some ways for everyone to stay connected. Of course, our patient navigation service is available for people for one-on-one information, assistance. Our Peer Connect program, Amy mentioned a few of these. It's a one-on-one support with a trained peer guide. And so that's available as well. Chordoma Connections, of course, our online community. We also have a Chordoma survivorship survey going on right now, and the U.S. National Cancer Institute Natural History Studies conducted. And those are two ways for people to be able to contribute and to the, help the work of the foundation, and also help researchers who are trying to improve treatments for chordoma. And the great thing about all of these is that they're available to you at home. So you can, it's really good in times like these. And of course, if you're not signed up for our e-newsletter, you can sign up on our website to make sure that we can stay in touch. If you want to connect with Susie, you can go to her website, susiereinhart.com, and read her blog and find out about her life coaching services and where to buy her book. And you can also email her and keep in touch with her that way. I know she'd love to hear from you. So thank you all participants, to all of you for joining us. Keep an eye out for an email from me, which will include a link to an evaluation form so you can tell us what you thought of the webinar today. It will also include links to the resources that I just mentioned. And one final huge thank you to our speakers for the thoughtfulness, the encouragement, and inspiration to make sure that we are caring for ourselves. It was really, really great to have you. And with that, everyone take good care and be well. Thank you.
Thank you.
Thank
everybody.
you.
Thank you, Shannon. Thank you, Jen. Thank you, Andrea. Bye all.
Thanks, guys.
Bye. Thank you, everyone.
Bye.
Ciao.